Welcome to Sonstein Sessions on iHeartRadio. Conversations about issues that matter. Here's your host, winner of 2 Gracie Awards, Shelli Sonstein.
And I say good morning to one of my favorite fathers, Michael Barasch, lawyers for the 9/11 community, Barasch and McGarry. And happy Father's Day to you. You are the dad of 2.
Thank you so much. Yeah, I am a dad of 2, and of course I can't help but think of my own dad today, who passed away 9 years ago. But I know this is a Hallmark holiday, but it really does make me smile thinking of my own dad.
Was he an attorney too?
No, but he forced me to go to law school because
Really?
I was a history major at college. And he said to me, "What are you going to do? You're not qualified to do anything other than be a teacher." And I said, "Well, what's wrong with that?" He goes, "Go to law school, and then you can decide what you want to do. You don't have to be a lawyer." So I went to law school, and then I ended up working part-time for one of his buddies who was a trial attorney, and I got bit by the trial bug. It was so much fun going to court and watching people try cases that I wanted to try it. And if it wasn't for him urging me to do this, and I have to give my mom credit, she as well, I would have gone into the insurance business, which is what he did. But he was a GI. He was a proud member of General Patton's forces. And he actually wrote a biography an autobiography at the end of his life. He spent the last 3 years doing it. It's funny. It's touching. It talks about him going to DeWitt Clinton High School in the Bronx and then serving under General Patton. And, of course, he ran into, this is a funny story, he ran into General Patton once during his stint in Europe. And Patton was there at the corner as the soldiers are marching by, and my father, who was a little bit of a wise guy from the Bronx, yells out, "Hey, General Patton, how you doing?" And Patton looked at him and says, "Move your ass, soldier." And those are the only words Patton ever said to my father. And the name of my father's autobiography is "Move Your Ass, Soldier."
Oh, that is too funny. That is too funny. Well, on the more serious side, one of the things that has really not been touched on during this pandemic is the continuing loss in the 9/11 community. And I'm speaking specifically, we have lost a number of 9/11 first responders. Their health systems were already compromised before COVID-19, and they were most at risk for coronavirus. But I understand the FDNY post 9/11 death toll is now 223, and at last count with the NYPD, at least 246. And it's kind of hard to determine how many of those we have lost because of COVID-19. But even those who haven't directly died as a result could not get in for their scans and their tests and their medical appointments during this time.
Yeah.
Something people don't think of.
Right. I look at this almost like as a baseball analogy. 3 strikes and you're out, sadly, in baseball. Well, the first thing our heroes did wrong was believing the EPA when they assured us all that the air was safe. Then, strike 2, they got respiratory illnesses and cancers, which, as you just pointed out, make them more vulnerable to the coronavirus than a healthy person. As a matter of fact, the New York Times reported last week that 9 out of the 10 people who have died from COVID-19 had underlying respiratory conditions. Not surprising, because their immune systems suck. And then the third strike, of course, is people are now dying. And my law firm alone has lost about 20 of our clients. Now, of course, I represent the sickest of the sickest, people with severe pulmonary fibrosis, asthma, cancers where they've had radiation or chemotherapy, which has greatly compromised their immune system. These people really have to be so careful, Shelli. They have to really adhere to the CDC when it says stay home, wear a mask, wash your hands. I know it's not manly to do it, but boy, these people really have to take care of themselves. And just to put those numbers that you just read in perspective. As everyone knows, we lost 343 members of the FDNY on 9/11. We lost 60 NYPD and Port Authority cops. That's a total of 403. Well, you just read two numbers, 223 fire department and 246 cops. That's 469 of New York City's first responders who have died of their 9/11 illnesses, and that doesn't even count Port Authority cops, and you know there are dozens of them as well. So it's heartbreaking. Thank God for Jon Stewart, John Field. They got this bill extended for everyone's lifetime. But, you know, to have people dying of COVID now is just so sad. It really is.
Also, one of the things you had mentioned to me recently in the World Trade Center Health Program, and if you were there at the World Trade Center on 9/11, or you spent any time below Canal Street in the 8 months following, we're talking about residents, volunteers, and you have a health problem, you can get enrolled in the World Trade Center Health Program, which is free, lifetime medical care. But I think you mentioned to me that only 5% of those in the WTC Health Program are office workers. So there are thousands and thousands of
literally
either current
hundreds of thousands.
Wow. That
Yeah,
have
so
not, we're not reaching
statistic.
them.
Yeah, and you know what? It really shows that this is my pledge now to the 9/11 community, is to not stop getting the word out there. It's a little harder now that I don't have the ability to go speak to groups and go speak to cancer support groups, which is something we were doing. But of the 500,000 people in the 9/11 community, 100,000 of them are first responders, and they make up 80% of the people who are enrolled in the free World Trade Center Health Program. That means that only 5% of the downtown office workers, residents, students, and teachers, that's 5% of 400,000 people, have bothered to enroll in what is a free health program. So if, God forbid, you're ever diagnosed with any of the 68 cancers or the respiratory illnesses that have been linked to the toxic dust at the World Trade Center, you get your copays, your deductibles paid for the rest of your life. And if you don't have health insurance, the World Trade Center Health Program is free for you completely. And yet they haven't applied. So why is that? They simply don't know about it. And so that's why I always thank you for helping me spread the word about this free health program. It's so important. It's in all 50 states. So if any of your listeners are thinking about their friends in Florida, North Carolina, Arizona, California, where we represent people all over the country now, please, if you know someone who's just had a basal cell carcinoma, which a lot of people say, that's cancer? Yes, it's cancer. Squamous cell is cancer. And, oh, by the way, if you needed a little encouragement, the Victim Compensation Fund is paying $90,000 to those people. Take advantage, or as Jon Stewart said, access what you are entitled to. We fought so hard to get Congress to permanently extend the health program and permanently extend the Victim Compensation Fund for everybody who was in the exposure zone. Access what you are entitled to.
You know, I find a certain irony in this situation in terms of the biggest crises of a generation. So after 9/11 and working on the pile, there was the mask issue because the EPA declared the air was safe. So our first responders took off their masks, worked on the pile, and now as a result, they're dying. They're getting sick and they're dying. And here, again, did we not learn our lesson? Did we not learn our lesson about the masks? First of all, we had to fight for the first responders early on in the pandemic, not even so early on. In late March, I remember making this a big issue on air. Mask them up, make sure they have their protective equipment. How are we in the same situation 19 years later?
You know what? Shame on us. We just don't learn the lessons of history. Or how many times do you have to be banged on the head before you actually react? Why weren't we prepared with thousands and thousands of these surgical masks. We know that eventually there's going to be another crisis.
Right.
So if hopefully our legislators are somewhat smart enough to now do the right thing and stockpile these masks and ventilators, because it's not a question of if. There will be another crisis. Nobody knows when,
and a second
nobody knows
wave.
what it's going to be. Yeah, well,
Right.
that crisis could be this fall.
Right.
Nobody has a crystal ball, Shelli, but we should certainly get our acts together.
And speaking of the masks, first of all, kudos to Barasch and McGarry for donating how many masks to frontliners?
50,000. We gave away 50,000, including to every firehouse. We also, listen, I'm proud to do this. I mean, I can't think of anything else that a law firm can do that is this meaningful at this time. So, we did a mask and lunch donation drive, and I'm so proud of the 75 people in my firm. Everybody who is healthy participated, going to the local medical centers and hospitals, we bought meals from local restaurants and delis for our nurses and doctors and emergency care workers. I'm really proud of everybody for participating.
I wanted to ask on a separate subject, because we have dual crises right now that actually dovetail into one another, the pandemic and also the Black Lives Matter movement. And I don't know about you, but when I was growing up, I was an activist. I was wondering how your young adult children, you have kids in their 20s, right? How are they?
Mm-hmm,
are
yes.
they involved at all? What's going on with your own kids with this?
Well, before I get to my own kids, let me share with you one other thing. I was talking to my 83-year-old political science teacher from college, and he gave some sombering thought to what's going on. It's not just the two crises that you mentioned, which was ignited by the racist cop, or as this political science teacher who is incredibly conservative said, the sadistic cop in Minnesota. But, sure, that may have been the match that lit the flame, which is now, gripping our nation. But you also have an economic crisis.
Right.
So the pandemic caused the economic crisis, which was also a major factor in everybody realizing now that there is a huge disparity in the way rich people versus poor people get medical treatment in this country. And, that's something both my kids, even though my son is very conservative and a Republican and my daughter is very liberal and a Democrat, we happen to be, my wife and I tend to be more moderate because I represent so many people on both ends of the spectrum. So I never really get involved in politics. But one thing everybody can agree on is that there is a basic unfairness in this country, and we are seeing the results of it. So I'm no Bernie Sanders fan, but on the other hand, he is right. We do need universal health care, because if the poor people get sick because they can't afford when eventually they do discover a cure for this COVID-19, you want everybody getting this vaccination, because if you don't give it to everybody, they're going to just infect each other, and then they're going to infect us. So, and it's going to affect the economy even more. So, I hope that's one of the good things that comes out of this, is that we realize that we need to do a better job taking care of each other.
Okay, we have run out of time. I thank you, Michael Barasch of Barasch and McGarry, lawyers for the 9/11 community, 911victimfund.com, 911victimfund.com.
You've been listening to Sonstein Sessions, a production of iHeartRadio.